Hey everyone, and welcome to our special Google Hangout on Air. I'm Sunny Galt with the New Mommy Media Network. We produce audio podcasts for new and expecting parents. We really like doing these hangouts where we explore different parenting topics. And today's parenting topic really hits home for me. It's about your pelvic floor and how it's impacted by pregnancy and childbirth. And me having 4 kids, I've done this a few times already and have experienced a lot of this firsthand. Of course, this Google Hangout is a partnership between the Parent Connection and Scripps Health, as well as New Mommy Media. And today our expert is Megan Franks. Megan, welcome to our Hangout. Can you tell everyone a little bit about yourself?
Hi, Sunny. Thanks. My name is Megan Franks. I'm a licensed physical therapist, and I have a board specialty in women's health. So what that means is I treat different diagnoses that involve maybe bladder issues or bowel issues, specifically maybe leaking of urine, maybe leaking of stool. As far as urinary frequency, if everyone knows someone that always has to go to the bathroom and make that stop all the time. Also, I treat sexual dysfunction, so pain with intercourse, maybe people that have never been able to have intercourse due to pain. And also all those things that go along with pregnancy and postpartum as far as pelvic pain, back pain. So a little bit about myself personally, I have a 13-month-old baby. So not in addition to all my training, that's definitely, you learn a lot going through it yourself.
That's right. You got some personal experience with this, right?
Yes, exactly. Yeah.
All right. So let's talk about the pelvic floor. A lot of people watching may have never even heard of that term before. So what exactly is it? What area of the body are we talking about here?
The pelvic floor is basically the floor of your core. So if you think of the pelvis, and everyone always thinks about those core muscles, thinking of the abdominal muscles wrapping around the spine. But at the base of that is those pelvic floor muscles, tissues, and structures that help hold the pelvis stable also. So you can think of it like a brown grocery bag, and thinking of the pelvic floors at the base and the abdominal muscles are at the side of the bag. So the pelvic floor has several different functions. One is that supportive function. It holds everything nice and stable so that we can do all the functions we need to do. And also it has a sphincteric function, so it surrounds the urethra opening where the urine comes out. It surrounds the vaginal opening and the anal opening. So helping close down those openings and also helping them relax too when you need to relax. Let's see, stability function, the sphincteric function, sexual function, these muscles contract with orgasm. And also these muscles have a pumping effect too. So gently contracting these muscles helps blood flow, and with injury after such as childbirth, gently pumping these muscles can help with the inflammation down there. So
how does pregnancy impact this area that we've been talking about, this pelvic floor?
Yeah, so with pregnancy, there's a lot of things going on. One is just the hormonal changes that are happening. So these hormones are designed to help prepare the body for delivery and carry baby. So these hormones are relaxing the tissues and the structures. And then you have the physical changes of the weight of the uterus, the weight of the baby, throwing us into different postures, stretching out abdominal muscles that normally would help keep us nice and stable. And so with the pelvic floor, all of these changes with the weight is, again, thinking back to that brown paper bag. All the weight inside that bag causes these muscles to get stressed and strained and weak.
And how does childbirth then impact the pelvic floor? We were talking about how pregnancy impacts it. What about childbirth? And can you also break it down, what it's like for vaginal birth versus a cesarean birth, if there is indeed a difference?
So with childbirth, so a vaginal delivery, obviously those muscles are going to have quite a bit of stress and strain. And with that stress and strain, they can be weakened or even damaged where they're torn, and maybe even having stitches to repair them. And with the weakened muscles, the function of the muscle just isn't working properly. So that's where you can have symptoms of the urinary incontinence or maybe pelvic pain with intercourse. As far as the C-section, you still can have a lot of the issues just from pregnancy, but with that, obviously, the incision goes through the abdominal muscles, so weakening of those abdominal muscles can create changes with structural function, and so I guess everyone is a little bit different, and unfortunately, just because you have a C-section doesn't mean that your pelvic floor will be perfect, just because of all the changes that happen with pregnancy.
And does the pelvic floor ever go back to its original pre-pregnancy form, or is it always changed? Not necessarily there's a problem, but has it, just, I guess, childbirth always changed the pelvic floor from what it was prior to becoming pregnant and having a baby?
Yeah, good question. And it really depends. Certainly, like you mentioned, the goal is to get back to function, and the pelvic floor, definitely the ligaments and structures they do get stretched out, and they're never quite the same, but certainly we can try to make up for it with better muscle strength, and the goal is to get back to doing what you need to do and pain-free.
What are some of the common problems that women face when it comes to their pelvic floor after having a baby? What would you say the top concerns are?
One of the most common and thought of is urinary leakage or urinary incontinence. And so that's when maybe you cough or sneeze or go to try to get back to exercise, and you go for a run and you notice you're leaking urine. Also, if another common, less known problem is the feeling that there's something heavy, and maybe you feel like your organs are kind of coming out your vagina. And that is called pelvic prolapse, and that's when there's just extra movement of those organs and they're descending down. And so again, that's pelvic prolapse, when the bladder or the uterus or the bowel just isn't staying in its normal location. And then other complications could be low back pain, just from the fact that the body is still healing, but then all of a sudden, there's a newborn to lift, and car seats to lift, and in and out of cars, and all the things that you have to do just right after you give birth.
I think there might be some moms listening to this going, wow, I have experienced some of this. You do hear moms talk about incontinence immediately after giving birth. At what point is that normal versus something that maybe they should look into a little bit further?
Yep, there's certainly a healing period that is going to be occurring, but you want to make sure that you're heading in the right direction, that you're getting better. And in some other countries, they have physical therapy, women's health physical therapy right from the start. And certainly, I agree. I think that would be ideally right from the start, making sure that you're strengthening the right muscles, you're moving in the right way to optimize your healing. But I would say if you're not getting better, then to talk to your medical doctor or seek out a women's health physical therapist to get you to where you need to be.
Now let's go back a little bit and talk about the treatment options for some of those. And I know that we talked about the different issues. So there were a few of them that we mentioned. Can you talk more about the treatment for those? What can moms expect if they do get help in this area? How are those problems typically treated?
In physical therapy, we would check to make sure your pelvic floor muscles, you're able to contract them or squeeze them. So these are those muscles you've heard about those Kegel exercises. And so I'd make sure that you would know how to activate those muscles and put you on a strength program to make them stronger. In addition, strengthening the core muscles, because that's the foundation that'll help the pelvic floor become even stronger. So issues like urinary incontinence, we're looking at strengthening those muscles, and we're also looking at making sure they're on at the right time. So every time you jump or stand up, that those muscles are responding before closing down those openings. Same with prolapse. So again, strengthening that muscle that helps support, that is that base, kind of all those organs are resting on those muscles. So strengthening that would help keep everything up and in. Sometimes if someone really wants to get back to jogging, often we need to look to see if they might need a pessary, which is a supportive device inserted in the vagina, just to help support those organs so that they're not just getting kind of jarred around and further stretched and damaged more. And so just kind of looking at the whole picture, looking at posture and body mechanics, and a lot of education, making sure the abdominal muscles they've come back together, and the rectus abdominis and is offering great abdominal support. Sometimes they can separate with pregnancy.
Is that something that most women have to continue to do, or is it a matter of, you mentioned Kegels, is it a matter of just doing your Kegels to get back to, where your strength should be, and then it should stay there? Or is it something we always have to manage, is what I'm trying to figure out?
Yes, yeah. So it kind of just similar to other physical therapy, whether your shoulder or your ankle. First, it would be more intensive exercises where you're doing them during the day, maybe 2 to 3 times. But exactly, once you kind of reach the point where your goals are met, your symptoms are not there anymore, then I do recommend patients and people still practice the exercise. I usually say, even if you do just kind of 10 a day, just to keep your mind on those muscles, but also the goal is to progress someone back to their function or their sport, or to get throughout your day that your body is naturally incorporating those muscles back in. Every time you lift your baby, those muscles turn on and are exercising without you even telling them to exercise.
I'm trying to figure out, for moms that are just now hearing this information, like, wow, I've never really heard of anything like this before. What would be the first step? Who should they get in touch with, is, to be able to determine if they need additional help? Is going to a physical therapist, is that the first step? Or you tell me.
Usually where I work, what I recommend is that you talk with your doctor, it could be your primary doctor or your OB/GYN, and from there they could write a referral for a physical therapist. And from there, you need to find a physical therapist that does specialize in pelvic dysfunctions or women's health. So you can go on to womenshealthapta.org. That's womenshealthapta.org, and go to PT Finder and search for a physical therapist that specializes. You can go to a physical therapist without having to get the referral. So it all just depends on your insurance and the situation.
All right. Well, I'm glad insurance is covering this, and, more and more women are finding out about this, and that there are treatment options, because let's face it, it can be a very embarrassing thing. We already gave birth to a baby. We're concentrating on other things. You have a 13-month-old. There's other mommy things that you're focused on in your world, right? And so this is just one more thing that sometimes is kind of frustrating. And I'm glad that more and more women are getting help. Megan, anything else you want to add before we wrap things up?
Thanks so much for having me, and I hope we all can talk with our friends and kind of get the word out there, so that so many women that are kind of dealing with these issues get some help.
All right, Megan, thanks so much for being with us today. We certainly appreciate it. We also want to thank Scripps Health as well as San Diego Parent Connection for partnering with us to bring this content to you. If you haven't checked out the San Diego Parent Connection yet, please do so, especially if you're here in the San Diego area. Lots of great programs for new parents, and you can check them out at sandiegoparent.com. We'd also love for you to check out newmommymedia.com. That's where we have all of our audio podcasts, and we've got tons of different topics out there. We've covered a lot of the issues that we've talked about today, a lot having to do with postpartum, your pelvic floor, urinary incontinence, a lot of these common things that moms struggle with after having a baby. So check us out at newmommymedia.com. And we hope you really enjoyed today's hangout. If you did, please share it with another mom, another dad, another parent, so we can help them out as well.